call the member for Perth.
Thank you, Deputy Speaker. I love Medicare, and when you are standing in the face of a global pandemic, I think every Australian would recognise just how lucky we are to have a public health system that allows all Australians to access healthcare, regardless of their income, regardless of their station in life. It is something we are truly lucky to have. And as we're talking about current health challenges, I want to take this opportunity to thank all of the health professionals who have and sadly will, in coming weeks and months, protect and help people who suffer from the coronavirus. Thank you to the doctors and nurses. Thank you to the orderlies. Thank you to the cleaners, some of the unsung heroes of our health system. Without cleaners, you don't have a hospital, you just have a disease factory. Thank you to everyone who works in making sure everyone is fed in our hospitals, and to everyone who works in hospital administration. My grandmother, Pat, worked in hospital admin at Charlie Gardner Hospital in Perth for many, many years. I know that it takes a village to run a hospital, and I want to thank every single person who is probably working a little bit more than they would have expected as a result of some of the health challenges our nation and the world faces. As a child, I was a chronic asthmatic. I was in and out of hospital more times than my parents can count. They probably broke most of the traffic codes, rushing me to and from hospital at different times. And I'm so grateful that as a child, I grew up under Medicare. I grew up in Bob Hawke's Australia. I believe that Medicare is one of Australia's greatest public policy achievements. It is, in my view, more Australian than Vegemite. And it's something that didn't have an easy start in life, poor Medicare, and it is something that we have had to fight to defend time and time again. I'm just going to go through some of the history of Medicare. 1975, the Whitlam government introduced Medibank, described by then Health Minister Bill Hayden as, quote, the most equitable and efficient means of providing health insurance coverage for all Australians. But then from 1976 till 1983, we saw systematic destruction of the Medibank system by the Fraser government. 1978, they made health insurance optional, effectively ending universal health care. Medibank Private was set up. Hospital agreements with the states and territories were ripped up, and bulk billing was restricted to just pension card holders. Thankfully, in 1983, the Hawke Labor government, as one of their first acts, was to begin rebuilding the Medicare system. And on 1 February 1984, they restored Australia's universal healthcare system. Now, this motion has some interesting facts in it, and the member for Stirling earlier mentioned facts and how important they are. I'll note that the member for Stirling did fail to mention the 5-year Medicare freeze that his government instituted. We also know that while the member for Lynn has told us that 86.2% of GP services are bulk billed, the Australian Medical Association and the Royal Australian College of General Practitioners have told us themselves that these figures are misleading. They're calculated on services rather than on patients. A more honest figure is the one provided by the Royal Australian College of General Practitioners, suggesting closer to 66% of GP patient consultations are bulk billed. And the Department of Health's own data shows that in 2018-19, just 52.7% of patients in the Perth electorate were bulk billed when they visited their GP. Surveys show that only 23% of GPs bulk bill all their patients, and that figure is going down and down and down. And when we think about the sorts of things that happen when people can't afford to visit their GP, it might mean that they actually end up costing our health system more, something that could have really catastrophic effects as we face global pandemics like the coronavirus. And I will never let this government forget that in their 2014 budget, the budget of cuts and charges, the Abbott-Turnbull-Morrison government, and I'll give Joe Hockey an honourable mention as well, they attempted to introduce a $7 co-payment for GP visits. That was a terrible idea. It wasn't means tested. It would have captured all patients. It would have captured children, pensioners, the chronically ill, people on New Start. It was a terrible idea, all because of an ideological obsession with sending a price signal. We know that the privatisation agenda of this government doesn't stop when it comes to sending price signals, Medicare freezes or co-payments. We've just recently seen the government, thankfully, back down on their plans to privatise the aged care assessment teams process.
Order. The member's time
privatisation in
has
this
expired.
government's
I thank the member.